in.
Hi, my name is Kayla. I'm going to be your nurse today. I'm here to do a quick head to toe assessment. It should take me about 15 minutes. Is that okay with you?
Yes.
Alright, perfect. Gelling in. Raising the bed. Alright, perfect. And then can I get your name and date of birth, please?
Emma Jones, June 4th, 2004.
Alright, and I'm going to ask you some silly questions. Do you know where you are?
In the hospital.
And then do you know why?
For an assessment.
Alright, and then do you know today's date?
March 11th.
Alright, perfect. The patient is ANO times 4, looks well groomed, well nourished, good posture, and has a stable mood. And then do you have any pain today?
Just a migraine.
Alright, and then is it throbbing, sharp, dull kind of pain?
It's throbbing.
Throbbing? Alright, and then do you know when it started?
A couple days ago.
Alright, and then does it usually last this long?
No.
Okay, and then is it localized or is it traveling throughout the body?
It's
The
localized.
Pain? Localized pain? Alright, and then do you know where? Is it like on your temporal or frontal?
I would say it's on the frontal.
Frontal? Okay. And then on a scale of 0 to 10, 10 being the worst pain ever, what would you rate the pain?
A 5.
Alrighty, and then is there anything that helps the pain?
Just like Midol.
And is there anything that makes it worse?
Running.
Alright, I will let the provider know, and then we will circle back to that after my assessments. I am now going to check your eyes. I'm just going to have my hand rest on your head. Alright, perfect. And then can you follow my pen, please? Alright, patient is Perla and EMOS is intact. And can I have you close your eyes for me, please? And then I'm going to make some noise on one of your ears, and then you let me know which side it's on.
Left. Right. Both.
Alright, perfect. And then I'm going to check the inside of your ears. Alright, no earwax, drainage, or erythema. And then can I have you lift up your nose for me, please? Alright. Septum is midline. Membranes look good. No erythema, and then also no drainage. And then can I have you open your mouth, please? And then say ah. Alright, patient's membranes are intact. Dentations look good. No thrush on the tongue, and then the uvula rises when the patient says ah. Alright, next I am going to listen to your lungs. I'm going to clean my stethoscope first. And then I would be doing this on skin. And then can I have you just take a deep breath every time you feel my stethoscope? Right upper lobe, left upper lobe, right upper lobe, left upper lobe, right lower lobe, left lower lobe. Alright, perfect. And then can I have you raise your arms for me, please? Right upper lobe, right middle lobe, and then right lower lobe. And then the other side. Left upper lobe, the space between your two lobes, and then your left lower lobe. Alright, and then can I have you stand up for me, please? Alright, and then can I have you face the window? And then can I have you move your hair up to the front? I'm going to listen to the back side of your lungs. Left upper lobe, right upper lobe, left lower lobe, right upper lobe, left lower lobe, right lower lobe, left lower lobe, and then right lower lobe. All right, your lungs sound good. It is clear in all lobes. I hear no crackles or wheezing. And then I'm gonna place my hand on your back, and then can I have you take a deep breath in? And then let it out. Perfect. All right, your breathing is symmetrical, even, and unlabored. And then I'm just going to do a little bit of percussion on your back. All right, on the right side, it is dull until I get to the 5th intercostal space, then it's tympanic, and then on the left side, it is dull until I reach the 4th intercostal space. Alrighty, and then I'm going to listen to your heart. You can face me. All right, thank you. All right. Aortic, 2nd intercostal space, right sternum border, pulmonic, 2nd intercostal space, left sternum border, tricuspid, 4th intercostal space, left sternum border. And can I lift your breast tissue up for me, please? Thank you. And then 5th intercostal space on the mid-clavicle line. All right, now I'm just gonna listen one more time on the bell side. Aortic, 2nd intercostal space, right sternum border, pulmonic, 2nd intercostal space, left sternum border, tricuspid, 4th intercostal space, left sternum border. And then can you lift it up again one more time? And then mitral is going to be the 5th intercostal space on the clavicle midline. All right. Your heart sounds good. I heard the S1 and S2, and then I heard no murmurs, no gallops. And then can I have you lift the breast tissue just one more time? I'm going to check for your apical pulse, and then can you lean forward? All right, apical pulse is strong and within normal limits. All right, now I'm gonna check your abdomen. Can I have you lay down for me, please? When was your last bowel movement?
Earlier today.
All right, perfect. And was everything about it normal?
Yes.
All right, I'm just gonna lift up your shirt a bit. All right, patient's stomach is flat. And also no scarring, no piercings, no tattoos. Umbilicus is midline. I'm going to listen to the 4 quadrants now. All right, all 4 quadrants are normal active. Cleaning my stethoscope. All right, now I'm just going to do some percussion on your stomach. All right, it is tympanic all throughout the quadrants. And then can I have you lift your knees up for me, please? Thank you. I'm just gonna do a little bit of palpating. Let me know if you feel any pain. All right, any pain?
No pain.
All right, patient reports no pain and I felt no hard masses. You can stand up now, or you can sit. All right, perfect. All right, can I see your wrist, please? Checking radial pulses. All right, radial pulses is 2 plus bilateral. And then can I go like this for me, please? All right, I'm gonna add some pressure. Try not to move. All right, and can you squeeze my fingers as hard as you can? All right, grip strength is 5 out of 5. And then can I see your fingers, please? Cap refill is within 3 seconds. Then checking for tenting and any edema. None present. CMS is intact. All right, now I'm going to check your legs. Can I have you raise them, lower them, and can you kick out, and kick back in, and kick out, and kick in. Perfect. And then can I have you open your legs, and then close. Perfect. All right. Strength and motion is 5 out of 5 in both legs. And then I'm just going to check your cap refill in your feet. Putting on hand hygiene and gloves. Alright, cap refill is within 3 seconds. Then I'm just gonna check the pulses. Alright, taking off my gloves, hand hygiene. Alright, your pulses are 2 plus bilateral in both the dorsalis pedis and then the posterior tibial. And then throughout my observation, the patient's skin is consistent with ethnicity. I see no moles, scarring, or lesions, and all looks intact. Did you have any questions for me at all before I leave?
No questions.
All right, perfect. I'm going to lower your bed back down for you. All right, and then here's your call light. Feel free to call me whenever you need to. And then raising the bed rails. All right, thank you for your time.